there anything I can do?
Yes, can you tell me why my dad's not peeing? He's not drinking. His code's changing.
Part of the transitioning process is the blood pressure will drop. It may not pee as much. In addition to the color may
No, it's
change.
switching back to a full code. Me and my dad gonna walk out the hospital. I'm not doing this
Oh,
right
you want
now.
to change him to a full cold?
Yes, I want to change it to a full code.
Well, what I can do is I can call the doctor and we can get him at the bedside. So, you guys can talk
Yes, I
further about
refuse for you
that.
guys to kill my dad.
Okay.
We're leaving
All
out the
right. Well,
hospital
then,
right now.
is there anything else you need? I can do some water,
No, just call
crackers.
the doctor.
Okay. All right. I totally understand, Shelly. I lost my grandma it's been a couple years now. And, as nurses, it's easy for us to process information and we know, hey, all the ins and outs when it comes to making sure a patient is comfortable while they're transitioning. But when it's your own family, you have a moment where you just kind of get delirious and you don't want to accept that, my loved one's about to pass away. And I totally have no control over it. I can't stop it. And you just want to blame everybody for it. And I remember rolling through those emotions where, I had to calm myself down, and it's my grandmother's choice. She was like, I want to go. I'm tired. And I think a part of us don't want them to be tired, but it's not our choice. And that's hard. My heart goes out to you. I'm sure you're a fantastic nurse. And the fact that you have that empathy that you can share with your patients, that creates patience, actually. You have more patience for these family members who are going through that experience because, going through having a loved one pass away is really, really hard. And no matter how educated you are, how much information when it's their time, they're going to go. And that's what you have to understand as a healthcare provider, as well as on the other end as being a family member as well, to understand that part. But anyways, thank you for commenting on my post. And I hope that this information and the collaborations we're doing is helping people out there who's may be going through this right now where they want to hold on, but you actually cause more harm than benefit for the person, especially if they're already suffering and you prolong their suffering because of how you feel and how you don't want it to happen. Hey guys, what a great question. So a full code is when you do all life measures to save somebody's life. So that means you're doing the CPR, you're going to be using medications, and you can even intubate. So you're doing whatever it takes to save the person's life. Then we have something called partial codes where the person chooses what exactly they want to have. So it can be like, I don't want chest compressions, but give me meds like to bring me back, or you can intubate me. Vice versa. You just pick and choose which life-saving measure that you would like to have. And then the third type of code is considered a no code, or DNR, do not resuscitate, and DNI, do not intubate. So that means that we're letting the person transition peacefully without any kind of life measure being done into the clip. The purpose of me adding this into the clip is to further educate how gruesome CPR can be for somebody who's in advanced age, in their 90s. Doing chest compressions on a 90-year-old body, you'll actually do more harm than good. I know some people laugh when I put the picture of a skeleton as a representation of the patient, but if you could imagine doing chest compressions on a skeleton, how the ribs and all these bones will just break. And that's what really happens when somebody's doing chest compressions on somebody who's older, or just they can be in their 60s or 70s. You're actually will do a lot more harm. You'll puncture ribs, you'll puncture organs, you'll send the person to the next life so much more quicker. So something to think about for those people that's out there. I know you love your family member, but imagine the vice versa. If you was the patient and somebody's on your chest and causing more harm, sometimes it's just not even worth it. Thank you. Keep the comments coming on. Damn.